If your child is almost 3 and not pronouncing all of his sounds correctly, it really depends on what sounds he or she is having difficulty with. A almost 3-year-old is not expected to be able to say all of the sounds correctly. There are certain sounds that will develop as he gets a little bit older. However, there are certain sounds such as the P sound or the B sound and the T and the D sound that should really be emerging, and he should be able to be pronouncing them correctly. If some of these early developing sounds are the ones that he's having difficulty with, then that might be a reason to go ahead and consult with a speech pathologist. The other thing is, depending on how your child is able to put the sounds together to make words and sentences. Again, a child who's almost 3, we wouldn't be expecting them to be able to pronounce every word correctly or to have everything that they say be understood by familiar and unfamiliar listeners. However, when they're almost 3, you, as their parent, should really be able to understand most of what they're saying, and unfamiliar listeners should be able to begin to understand a lot of what they're saying. If you have a hard time understanding anything that your child says, or if people who don't know your child have a hard time understanding anything, then that also might be a reason to go and consult with a speech pathologist to determine if there's anything that can be done at this early age to help your child with their sounds.